Where do stress fractures occur? Have you ever wondered where stress fractures happen most often? This question is vital for anyone involved in athletic training or sports. Stress fractures are common injuries that can sideline athletes if not recognized early. Let's break down the primary locations where these injuries occur. Stress fractures mainly affect the lower extremities, which are the bones that bear weight and experience repetitive impact during activities. The tibia, or shin bone, is the most frequent site for these fractures. In fact, it accounts for about 25 to 59% of stress fractures in runners and athletes. In children, these fractures often appear in the upper third of the tibia, while adults typically experience them in the middle and lower sections. Next up are the metatarsals, which are the long bones in your foot. They make up roughly 10 to 24% of stress fractures. The second and third metatarsals are particularly prone to injury, especially in sports that involve a lot of running or dancing. Another common area is the tarsal bones, including the navicular bone located in the midfoot. About 25% of stress fractures occur in this area. This is especially true for athletes involved in sports like basketball, soccer, and track and field, where sprinting and jumping are frequent. Navicular stress fractures usually happen in the central part of the bone. The fibula, which is the smaller bone of the lower leg, accounts for about 9% of stress fractures. While less common, stress fractures can also occur in the femur or thigh bone. These fractures can happen in the neck, head, or shaft of the femur and are significant due to their potential complications. Stress fractures in the upper extremities are rare, making up less than 10% of all cases. When they do occur, the ulna, which is the forearm bone, is the most commonly affected. This usually happens in sports that requiring repetitive use of the upper limbs. For professionals in athletic training, understanding where stress fractures occur is essential. Recognizing early signs can help prevent these injuries from worsening. Athletic trainers and sports medicine experts must monitor training loads and educate athletes about risk factors. Timely intervention is key. If a stress fracture is suspected, imaging techniques like magnetic resonance imaging can help identify subtle bone stress before a complete fracture occurs. This knowledge is vital for designing training programs that minimize the risk of injury. In summary, stress fractures primarily affect weight-bearing bones in the lower limbs, especially the tibia, metatarsals, and tarsal bones. Being aware of these common sites helps athletic trainers and coaches manage and prevent injuries effectively.